but an opportunity that we have today, which we have to look at in a positive light. That we're definitely focused on the disparities and the problems that we're having, and the huge issues of how we're going to address those problems. But until we had clinical data from drugs that were showing an impact on progression of the disease, none of this was really relevant. We have rational strategies to move forward now that we have clinical data, and they're strategies that range from new therapeutics. For example, there are complaints that these drugs that we have now just aren't good enough. Well, nobody said that this was going to be the home run on the first pitch. Um, I'm a baseball fan, and so. But what it does is if these drugs are slowing progression in some people, we have to figure out who those people are that they're working on and who is it not working on. And we have to be able to take that knowledge to primary care. And if we can figure out who it's working on, that's good because we can build on that knowledge. And even if they're not effective other than slowing and providing an extra 10, 12 months of independent life, which is not insignificant, by the way, what that does is it opens the window for combination therapies with drugs that could be tested and effective in combination with those drugs that are slowing progression, which on their own would have no impact on the disease at all. So we are entering a stage of potential precision medicine, which is why diagnoses across racial barriers are important, and defining a medication combination that will work on individual patients in a precision way. Take a page out of the cancer playbook. They're making it work for some cancers. And there are people who are surviving and living with cancer that it was a death sentence in a matter of months, as little as a couple of decades ago. And that's kind of where we are. So these disparities, we have rational strategies. We've been hearing about it. They're policy strategies. They're financial strategies uh, that we can, not just but just the scientific strategies and the medication strategies. It's everything that goes into what we need to be able to drive the field forward. Um, we are down to 8 minutes to go. Van, would you like to add to this conversation at this point?
Yes, thank you. I would love to. And perhaps one of the things I would like to offer as maybe a conclusion to my part of this roundtable is something important that Julie mentioned about the opportunity during the wellness exam to ask the question about how is your memory? And the purpose of this roundtable or the topic is centered around Alzheimer's disease diagnoses, right? And the vast differences in opportunities for getting such a diagnosis. Before we can even reach that, I would say, time or opportunity to get that diagnosis, uh, absent of culturally, linguistically tailored testing and etc., is I think it's important to ask a simple question: how is your memory? Do you have concerns about your memory? And I completely realize there are limitations, as Monique mentioned and Julie mentioned, about system factors, but regardless, asking the question. And I also bring this up as really important because in our registry, when we launched our registry, we didn't ask that question in general. We asked the question, do you have Alzheimer's disease or related dementias, right? As part of their health conditions background question. And not surprisingly, very few marked yes, right? For factors, as Barry mentioned earlier, about how there are stigma even, and also what our, Julie and Monique mentioned about underdiagnoses and things like that. Well, we immediately changed that through advice from our advisory board to ask a simple question: do you have concerns about your memory? And, listing some other symptoms related to AD, and now we have 13% about in our whole registry who have marked yes. So I just wanted to leave it, mention an important point of just asking.